This is really a critical point to discuss, and it's really not discussed much online or really anywhere in the public sphere, and it's a little bit misunderstood. But I want to talk about the length of an Invisalign case, as that might even relate to the price, the cost of an Invisalign treatment. We have a case here on the left with severe crowding. This was my case, and we started it about 10 months ago. And here's where we are now. You can see a great result. And if you look at the bottom, you can as well see how the teeth are lined up nicely. The bite, the function in this patient remains as good as it was at the start. So functionally, right now, it is not debatable that this patient is in great shape. But if you didn't catch the first time I quickly showed it, I'm going to blow this up. And this patient has already had one refinement, meaning they had an initial round of 30 aligners, then they had a second round of aligners that was probably about 10 to 12, and this is where they are. And if you look super closely, you might be able to see that this tooth is the slightest hair in, actually, maybe not even. This tooth may be the slightest hair out. You see, when I do that, I sort of just try to overcorrect it a bit. On the lower, though, there was definitely one tooth that is not ideal, and it's this central right here. Now, here's the issue. This patient, would they be happy with the result as it is now? Well, I think certainly, but they also may say, hey, this tooth is not perfectly straight. And this is how it works with Invisalign, because a lot of patients are after their teeth improve greatly, they don't wear it as much, or there can be stubborn aspects of the case. I use the analogy if somebody kind of signed up to lose 50 pounds and they did everything that the doctor said to get into a certain type of shape and that the trainer said, and they lost 48 pounds and they looked like an entirely new person. Even if they didn't meet their goal, they would still be a success. If you can get this tooth a little bit straighter, it is not going to lock things in like puzzle pieces and make it not move. Now, I'm not saying you shouldn't try to get this straighter, but here's the point I'm leading up to. If you go to an Invisalign provider and they charge you a high fee, that would be, I would say, arbitrarily in excess of maybe $7,000, $8,000, and they tell you everything is included. Okay, that's one thing. But a lot of people would rather pay $2,000, $3,000 less to get this kind of a result and not worry about perfection. Now, it's notorious that patients always tell me that they're not a perfectionist, and usually they become one. But I think here's the issue. If you want to give somebody aggressive fees, competitive fees, that can make them start the treatment. And if you're a consumer out there and you're hoping to spend $5,000, $6,000 for Invisalign, a lot of money, as opposed to like $8,000, $9,000, then you might be fine if you have a limited amount of refinements, meaning that in this case, the patient would have to accept this result or pay more to get it better. And it's a tricky thing because some people like the thought of paying more, but not being what they see as nickel and dimed, but they're paying more for it. Or you can sort of pay as you go. So just something to think about when you price your Invisalign cases. And also for patients out there, no orthodontist guarantees perfection. This is an outstanding result. I'll go back to the upper and you can see how fantastic it looks. And if this patient felt like this tooth was out still the tiniest bit, well, it could be for them to decide perhaps to pay more money to get a little bit better.